Minnesota, we know, is facing a critical shortage of rural mental health workers, especially in rural parts of the state. And in an effort to support the state, they're turning to a staple in many small communities, faith leaders. The Department of Agriculture is offering free suicide prevention training to faith leaders this spring. And this morning, we are joined by Meg Moynihan. She is the Senior Advisor of Rural Mental Health Programs for Minnesota Department of Agriculture. Meg, thanks for being here this morning.
Hi, Tom. It's my privilege. Thanks.
Such an important topic, we know, especially these days, post-COVID, it seems especially. Let's talk about some of the mental health services and suicide rates in particular in outstate Minnesota, and what are the numbers showing us?
Well, we know from our partners at the Minnesota Department of the Health that suicide rates in rural areas can be 2.5 to 3 times higher than in metropolitan areas. And as the Department of Agriculture, we're very concerned and very interested in supporting farmers, other agriculture-connected people, and really the entire rural span of Minnesota in staying healthy and staying well and staying strong.
And it seems that faith leaders certainly are connected to the communities, especially rural communities. Why are we seeking them as kind of leaders for specialized training?
We find that to farm families and many rural people, faith and church going is a tremendously important part of their lives. And some of that is tradition. You know, their families may have gone to this church for generations. Some of it is spiritual, very spiritual people, some but not all. But they're also really important community and social connections. And the priest or pastor or minister is regarded as a trusted person, a free person to talk to. You know, you don't have to take your insurance card to them, and a person of integrity, and somebody that you can go to with a problem and confide in.
And maybe for some of these younger children in particular, younger people, they may see that person as less, you know, they're not as put off by, say, maybe someone who has a title, but someone who has training, but someone who maybe they know in their community.
Exactly, somebody that you have a relationship with.
Right. Tell us about the training and the skills that are so crucial for smaller communities to have so that we can get people like this into this field.
Well, we've learned that from many clergy that they don't cover suicide prevention in seminary very much. And so this is to teach skills about how to listen, how to appreciate signs that somebody may be at risk of suicide, how to connect them with help that will be effective, because we know suicide is preventable with the right help. And then in the case of the loss of a person to suicide, how to comfort the grieving and how to support people who lose someone to suicide in a healthy and supportive way.
Boy, it's such an awful thing when that happens, certainly. What about the stigma surrounding mental health, excuse me, and the importance of getting help for people who need it? That's another barrier.
I think farmers traditionally are people who get it done and say, you know, I am responsible for taking care of things. I am the person in charge and I need to make it work. And it can be very, very challenging in a rural community where everybody knows everybody else. I mean, we think of cities as being compact, but the community of farmers and rural people is not just geographic, it's across geographies. And everybody knows each other and everybody knows each other's business. And so sometimes it can feel very intimidating to seek help for this kind of a wellness problem, which we think of as wellness.
Well, let's hope that the people who need it get that help, because we certainly don't like to hear the numbers of suicide being greater than here in the city, certainly for the rural areas.
We want everybody to have the courage and capacity to live a long, full life.
That's exactly right. Thanks for being here, Meg, with
Thanks,
the message.
Tom.
An important one for so many people to hear. For information on training sessions, you can visit the State Department of Agriculture's website. If you have a loved one, maybe at risk of suicide or self-harm, you can call 988. That number will connect you to the National Suicide and Crisis Lifeline.